So I'll start with early loss of primary teeth. What are some reasons for that? Well, number one, it could be normal for the child, and most times that will be exactly what the case is, that it's normal for the child and they're just ahead of that time chart that I gave you for the normal quote-unquote times. For example, if the child was early to get his or her baby teeth as an infant, then it might be likely that they're early to lose their baby teeth and get their adult teeth. There could be a history of trauma, for example, avulsion. So it's important to ask his parents of a history if there has been any dental trauma recently. Now the other thing is there could be an underlying disease or medical disorder, which is less common, but you certainly could see, and it's important to be aware of. So in the interest of brevity, I'm not going to go through this list, and actually there's 2 slides of these diseases or disorders. I'll just name them, that could cause early exfoliation of a primary tooth. The first one, though, I just will say a few comments about hypophosphatasia, which is a genetic disorder. It's autosomal recessive of bone metabolism with a lack of serum alkaline phosphatase. And you basically get a cementum defect and can get early loss of primary teeth. The reason why I do want to say a few things about this is because if the primary tooth is lost with no root resorption, so you have an intact primary tooth that has exfoliated early, that could be the very first clinical sign of this disorder. So you might be, as a dentist, the first person to suspect this disorder in an individual, so it is quite important. The second reason why I'm saying a few things about it is because it is prevalent in Manitoba, especially in children of Mennonite heritage.